I've always been very active. Over time, I began to feel some pain in my right hip. The pain level on a scale of 1 to 10 was getting up to around 7 and 8. I could walk, but it was getting tough, even getting in and out of a car, and as you can imagine, playing golf or going to the gym was pretty much out of the question. So I made an appointment and went in to see Dr. Marshall. She had some concern. I was very close to being bone on that joint, that sooner or later I would need to have that joint replaced. I really felt good about her experience and what she's done. She only does knees and hips, and she only does the minimally invasive procedure. She had already performed at that point several hundred of these procedures, so I felt like I was in very good hands. She really let me know up front what was going to happen, that we were going to be able to get up and walk on it that first day, that I'd probably be able to go home the next day. It got to be the next morning. I was released at about 4 o'clock in the afternoon, so barely a day and a half after a total joint replacement. The most amazing thing to me about the days immediately after the surgery was how little pain I had, where I was up to about an 8 or a 9 on a scale of 1 to 10. The day after the procedure, when all the drugs had worn off, I was still at only about a 2, which I thought was just absolutely amazing for a major procedure like that. It's about a year and a half now since I've had the procedure, and I feel terrific. There is absolutely no pain on that joint. I'm able to do everything that I was able to do in the past. Any of my friends or family that I run across that are complaining about some knee problems or some hip problems, I don't hesitate to refer them to Dr. Marshall. You don't realize how much mobility means until you have a bad hip or a bad knee. And to have that fixed really does give you a new lease on life.